Hi, my name is Amy, and today I wanted to share with you one of the first reports that I got from a Lyme doctor, a Lyme specialist in DC. His name was Dr. Jacobs, and I'm going to share the full report in case you're interested. I didn't excuse the gum. I am trying to quit smoking because I'm going to probably be doing the IV antibiotic therapy anyway with Gemsic. But this is a report from Dr. Jacobs, and today's a bad day. It's not a good day. I took Noah to school this morning and I feel like I have the flu. You know, my hips hurt, my back hurts, my body is weak. I didn't have energy to go anywhere else this morning. You know, I wanted to go to the grocery store because my 4-year-old Noah asked for push pop ice cream, and I'll have to go later after I take a rest. But, you know, I walked up the stairs this morning. My knees hurt. Just weak. It stinks. So the report from Dr. David Jacobs is here. I don't know if you could see that. Yeah. And I'll go ahead and read it. Excuse my reading if it's off. My brain doesn't work so well sometimes. Dear Amanda, that's my official name. Amanda, everybody calls me Amy, but I was named Amanda. It was good meeting with you in late August. My reading is also slow, so don't mind that. It hasn't always been. I was disappointed that you were not able to follow up. Yeah, the follow-up. So we went to him. He gave me antibiotic, which I want to tell you about because it really helped. And it took like 70% of the pain and took the tremors and the head thing away. Hold on. Okay, so it took the hand tremors and the head tremors away. But it was very expensive. And I still wasn't thinking clearly. I had cognitive issues then, and we didn't follow up, my husband and I. We missed the appointment, and they would not reschedule another appointment. But he was a good doctor. I was disappointed that you were not able to follow up. Let me review the results thus far. You will then have to let me know how you want to proceed in the future. On August 27th, 2013, your height, your weight, you don't need to know that. This is your maximum height. Yeah, it's talking about schooling, my waist measurements, my pulse oximeter on room air was 98, your blood pressure 118/76, I don't know what that means. The upper airway revealed a reddened throat. There was a brown, from smoking. My tongue was brown. Yeah. I have a heart murmur. I should have read this before I was reading it to you. I'm sorry. Per Stacy. Oh, yeah. You don't even know all that. Yeah, it's talking about a rectal exam. Fast forward through this. Laboratory studies revealed a normal resting electrocardiogram. The breathing studies revealed air impairment in the smaller airways. This may be from smoking, probably. There was a trace of red blood cells in your urine, but no true infection. The tuberculosis test was normal. The hearing tests were good. The EEG done at Holy Spirit Hospital was read as normal. See, before this, my husband had drugged me everywhere. He took me to every hospital. He took me to York Memorial. We lived in PA, Pennsylvania. He took me to York Hospital, Memorial Hospital, Johns Hopkins, and the only thing done was at Memorial. They did a spinal tap to see if I had infection. Yes, my white blood cell count was high. It has been high since this incident, and nothing though. Nothing was abnormal except the white blood cell count and maybe a little high blood pressure, but So it just kept getting worse. And that's when the tremors started, and the head shaky tremors started. And he took me to Hershey Medical Center. And that was the best because I couldn't walk really. And I went in and I was begging them to do anything. And they sat me in the back room, in the emergency room. And I sat in there and, I told them what was going on. They weren't sure what was wrong with me. I think they thought I was crazy. And they were going to write me a prescription for narcotics. And I said, I do not take narcotics, because I'm a recovering alcoholic, and I just will not take narcotics. I wouldn't at that time take any narcotics. I won't still. I guess I'm not on them. I'm on something which is kind of controversial now from Gemsick, but it's not mind altering at all. And I'm on something that's derived from marijuana, and it actually helps what it's supposed to. It was a great disappointment because it didn't do anything but help what it was supposed to. And after 13 years of not using anything, I was looking for something. It'd be great to have a little, but nothing except the fact that it's amazing medication that I'm on. I'll tell you about that later. The marijuana derived medication. It's like cleaned, purified or something. And I can't be touched. And so it allows me to be touched and snuggle with my son, and it allows my husband to, touch me and snuggle with me, and that's nice. Anyway, they were going to prescribe me a narcotic at Hershey, and I said no. And they said, we can't do anything for you. And my husband is saying, he was very adamant, you need to admit her and figure out what's going on with her. Look at her. Her head is like bobbing, and she's just in terrible pain. I was crying, and they got security because my husband refused that I would leave or put my clothes back on. This is supposed to be about the Jacobs report. I'm sorry. Anyway, they got security, and they had to pick me up. My husband and somebody else picked me up. They dressed me because I couldn't dress myself, and put me in the wheelchair and escorted my husband out of Hershey. Meanwhile, I was like hyperventilating. I couldn't breathe because I was so upset. I was so desperate. I wanted anybody to help me. And I'm like this in my shirt, so embarrassed as my husband is wheeling me out of Hershey Medical Center. And he had to pick me up out of the wheelchair and put me into the car. And I was just so upset. I was so broken. I remember. And then that's when he took me directly to Holy Spirit Hospital, straight from Hershey to Holy Spirit. And they did extensive tests on me. And, of course, found out nothing was wrong. So these are some of the tests from Holy Spirit. Long story. That's why that made sense there. So the EEG done at Holy Spirit Hospital was read as normal. A colonoscopy revealed a sessile serrated edema in the summer, which actually is a precancerous polyp. I had those removed. I have to go every 5 years to get those removed. You should be followed over time for this. The CT scan of the head without contrast ordered at, this was done at Memorial Hospital in July, was, guess what, normal. You also had a normal MRI of the brain at that time. The blood studies for gluten or wheat abnormalities were normal. Extensive tests for tick-borne diseases, including actual DNA, PCR, replication results were 100% normal. Extensive tests for other infectious diseases such as toxoplasmosis were normal. The liver and kidney functions looked good. Your cholesterol profile was quite abnormal, suggesting a pre-diabetic pattern. Your white blood cell count was also elevated, reflecting an infection, although we could not be sure what type. The red blood red blood count was normal. The test for diabetes suggests that you are on the cusp of becoming a diabetic. Hemoglobin A1C. The thyroid function tests were normal. The ferritin level, which is the storage form of iron, was low, highly suggestive of iron deficiency. It's my puppy. Thought it was my husband. The vitamin B12 level was normal, but the vitamin D level was quite low, and I have enclosed a packet of articles about why it is important to supplement. Several markers for cancer were done, all of which were fortunately normal. The tests for Hep A and B prove that you are immune to Hep B, but not to Hep A, and you should be vaccinated. The C reaction protein reflecting inflammation. I have a terrible headache now. Just reading this is very difficult for me. You know, my brain is not functioning like it should, and it's giving me a headache. The C-reactive protein reflecting inflammation in the body was slightly elevated. Oh, I have elevated protein. Isn't that interesting? The antibody tests reflecting immune function were normal. The tests for measles, mumps confirm immunity for life. That's good to know. The tests for heavy metals were all normal. Let's review the significant issues as follows. Joint aches, severe fatigue, questionable Lyme tick exposure, prednisone treatment. You were in reasonably good health until July of this year. This was October 30th, 2013 that he wrote this report. Evidently, you awoke on July 7th or so with acute wrist pain, which persisted. At first, you thought it might have been an injury. A week or so later, you became severe and debilitating. You were overwhelmed by weakness, fatigue, and stabbing pains, and you could not walk. You thought there may have been a mole on your back. This fell off when you were swimming. You evidently developed a rash at the site. You saw your local doctor, who started you appropriately, in my opinion, on doxycycline for Lyme disease. After about a week or so on therapy, your doctor started you on prednisone, which improved your symptoms but did not eradicate them. You developed cognitive issues, and your doctor was concerned about meningitis. You actually had a spinal tap, which evidently was normal. As you attempted to taper off the prednisone, your symptoms became worse. Going back up to a full dose of prednisone did not result in any improvement. Therefore, you contacted the local Lyme Society, who put you in touch with Clongin Lab, and hence you're ending up in my office. This is going to cut out, I think, after 15 minutes, so I have 2 more minutes. I don't think I have this in order. Okay. I'm missing a page. No, here it is. That was number 4. So number 5. None of the blood studies confirmed any residual tick-borne illness because of the concern about possible babesiosis, another tick-borne illness. I initiated treatment with atovaquone. This is it. And azithromycin. Okay, so this is the name of the medication that I was on that stopped the tremors. For me, I don't know if it'll work for you. It's ATO. It looks backwards. Yeah, it's backwards like a mirror. That's really weird. ATOVAQUONE. Atoquan, and azithromycin. So I was on, I know it was that one, the Atoquan, which he wrote here also. as Meliquon, 750 milligrams twice a day for 10 days. And that is what stopped my tremors and 70% of the pain. I have more, so there'll be a second part of this.